What's up, everybody? Bryan Brozy here. I'm about to start episode of the podcast here. I am looking at the video just when we get done, about to upload it and kind of edit it and chop off the side and send it out to you guys. And I noticed that for some reason it's only Keoni's face. Typically it goes to who's ever talking. It just kind of automatically goes to that camera, but the entire time is Keoni's face. Which, not that it's a shame because it's Keoni, but it's a shame because I was doing a lot of hand gestures, kind of showing you curves of the spine and things like that. So unfortunately, that's missed, and you won't be seeing much of me. You might be seeing Keoni do a lot of listening. But I hope this episode's helpful. We'll get this worked out in the future. I'm on it, I have no idea why that happened. Hasn't happened on any other episode before. It didn't change any settings or anything like that, so I'll have to look into that. But I hope this episode's helpful. It'll be really helpful to go back and listen to some of those other episodes that we referenced, just to kind of give you an idea of what we're talking about or further go in depth on some of the things we're mentioning. And then definitely, like I mentioned throughout the podcast, if you type in my name, Bryan, Brozy, you will notice, and then you can pull up the exercises that I'm mentioning. So again, just my name plus the name of that exercise, and I should be the first video just by doing that. Feel free to give me a like, subscribe, comment, anything that'll help the YouTube algorithm, help me help more people. Other than that, now on to the show. Sorry about the mishap, and we look forward to speaking with you next time. What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing wonderful. I'm excited about this podcast. It's something that I see every day in my clinic, just back issues, back pain, postural issues. So I'm thrilled that you're going to talk about this topic today.
I'm sure you see a few of these things just walking around your day-to-day life. What we're talking about is spinal postures. So we've all seen a few abnormal spinal postures at Walmart or whatever the case may be.
Right.
Kind of in our day-to-day lives.
Well, even within myself, I see it.
Yes.
Just sitting at a desk all day and what's happening to my upper back and the tightness I experience.
Yeah, absolutely. And you mentioned just a good opportunity to talk about I think it's episode 14, but combating sitting. We kind of talk about some things that will relate to the thoracic spine and the neck here. And I'll touch on a few other podcast episodes that if you're looking for more may be helpful. But kind of what you're hitting at, Keoni, is what we're planning to talk about today, or what we're hoping to get across is just some general spinal hygiene. And that first, of course, starts with some of our knowledge, what we know about the spine. And I really want to talk about some natural curvatures of the spine and how they relate to your neck, back, discomfort, pain, and possible injury. And then just give you some daily general tips or some things to know to help improve your spinal hygiene as you go throughout your day to day.
Yeah, it's great.
So we'll kind of work our way from skull, or from the top of the head, or from the top of the spine, and work our way down to the lumbar spine. And this will be pretty brief. But the big thing I did want to kind of give a caveat to on this podcast is this could be super long and it could be super specific. So just as an example, as a physical therapist, we break down the cervical spine into a variety of regions. And so when we're just talking about the spine as a whole, we know the spine has a cervical portion, which is like the neck, has a thoracic portion, which is kind of your mid back. And then we have the lumbar spine, which is your lower back, thoracic portion being where the ribs are, cervical spine being above that, lumbar spine being below that. As a physical therapist, we break down those segments even further into different segments because they interact differently. So just an example with the cervical spine, obviously there's a component there that's really different where the head sits on top of the atlas, and then that atlas connects with the other, vertebrae 2 of the cervical spine. And that has a much different biomechanical component than different areas of the spine. So we're going to talk in big generalities today, but if you're looking for something more specific, or you've got more pinpoint pain or something more sinister going on, I definitely recommend seeing a therapist, chiropractor, rehab professional, or any sort of physiatrist or doctor to kind of further investigate the specifics of your situation. So we're going to talk very general, very overall, but again, knowing that these things can really be broke down, and then the whole spine, as we move from top to bottom, each segment has very specific changes and very specific things that we could appreciate. that we're not necessarily going to appreciate in this episode.
Okay.
So another caveat just to get into is just it's about specific spinal alignment. There is no perfect posture. So, if someone asks me, Bryan, what should my posture be like? That is really individual to you. But we do know that there are ideal alignments based off some of these curvatures we're going to talk about. So there's no blanket every human being should have this exact type of posture, because your spinal orientation is different. Some of the facets, which just means the joint surfaces where the vertebrae move on each other, are different from segment by segment or level by level, or just even based off our own individual kind of makeup. So while there may be a great and optimal spinal alignment, that's really specific to you. And overall, there's no one size fits all when it comes to spinal posture. So working our way down, starting at the neck here, the cervical spine, just to give us an idea of what its spinal structure is like, here's where we're going to see our first lordosis, and a lordosis being a backwards curve or like a reversed C-shaped curve. And this part of the reason we have this in the neck is because we have the weight of the head that's kind of supported by this natural cervical lordotic curvature. And here the spine and the cervical spine is much flatter surfaces where the joints move on each other and the facets move on each other. And it's the smallest of all the vertebrae. Why these flatter surfaces are important is because it allows for a little bit more rotation and side bending. So with these flatter surfaces, the neck is primarily the movement it's primarily able to do. It's very mobile. It's the most mobile segment of the spine, but it has a lot of rotation compared to any other segment of the spine. So just knowing as we move throughout our day-to-day task, most of our rotation should be coming through our neck, and we should have good free rotation throughout our neck.
And we should see that C curve or that lordotic curve in the neck, right? Just looking at somebody, because that's the main thing that well, at least with my chiropractor friends point out, some of my PT friends will point out that the cervical spine seems straight or lost that curvature.
Right. And then, so that's a great point of so we would see that if we removed all the beautiful tissues that make you, right? If we got rid of all the muscles, we got rid of all the ligaments, we were just looking at the bony structures, we may actually see that lordotic curvature. Some people it's exacerbated, and some people you can really see it just like to the naked eye looking at them from the side. In general, though, you may just get a small appreciation for the cervical like lordotic curvature. And to see that, you'd really want to kind of look grossly at the human being. So knowing that C7 is the last vertebrae, and that's pretty much the biggest bony prominence you can feel on your back.
Yeah.
If you kind of pick that C7, the biggest bony prominence on the bottom of your neck, pretty much, and start working your way all the way up to your skull, you will get an appreciation for your own lordotic curvature. It may not be as visible with the naked eye, though.
Right. And it could be covered up by whatever, musculature, the neck, or all that. Okay.
Yeah, absolutely. Absolutely. But you would, if it was just bones, if we just saw your skeleton, we would certainly get an appreciation for that curve.
So what you're saying is you would see the curve in just about everybody, just about, right?
Just about, yeah. Just about. In general, you should see a slight lordotic curvature.
Slight lordotic curve. But does modern living, does it straighten out the curve?
Yeah, really good point. So as far as modern living, what we see is we do tend to see more of a forward head posture, which does straighten out the curve.
Okay.
But then the caveat to that is also, as we get this more forward head posture, and let's say, I'm a student typing at my desk, I have to look up at my computer. And this is where, again, we could break it down into further segments, but at that suboccipital level, that craniocervical junction, where we're talking like the first first 2 or 3 vertebrae in the skull, that is going to typically, with these people that have a more flatter curve, be a little bit more extended. So you're going to exacerbate that almost lordotic curvature at the top, because you got to see what you're doing.
Right.
And that creates a host of problems and really aggravates the suboccipital muscles. And I do have a video called the suboccipital release on YouTube that you can find to address that. But in general, if you get a flatter curve and forward head posture, which is more common with our day-to-day life, then you actually end up seeing an exacerbated curvature of the lordotic curvature higher up in the neck.
I see. I
So you
see.
may
Okay.
see a flatter curve of the spine, and then it may look like the head is kind of, protruded out and extended up.
Up. Yeah, yeah, yeah. Okay.
And that's primarily what I see. I do see a lot of this forward head posture, and then you get this really tight at those first 2 or 3 levels, tight lordotic curvature where the person's trying to extend their cervical spine. Oddly enough, though, with guys, I would say, Keoni, I think we in general do have a tendency, especially as we age, to increase our lordotic curvature. And I'm just going to speak for myself, but as a man, you try and kind of look up, be proud. And then with that, I almost kind of rest my head back and hang out in the cervical extension. And I
Yeah.
found that with a lot of my older guy clients, and that it does both there, where it's exacerbating that lordotic curvature as well as really pinching that suboccipital or craniocervical portion that we talked about as well. So I do see kind of both ends of it. I do see,
Oh,
more flatter curves, but those I would say are fewer and far between than this increased lordotic curvature that comes from this forward head posture and then how we kind of hang out. What I would say with these people that are sitting and kind of how we see this flatter curve in general is what we see more as and we'll talk about this next, but an increased kyphotic posture of the thoracic spine, because that's coming along with their forward
I
head.
see. Right,
And
right,
then their
right.
cervical spine kind of works like a straw to lift that portion up and look. So typically I do see an increased lordotic curvature versus a reverse lordotic curvature, more straight neck being a reverse
And
lordotic
it, and
curvature.
and you really, so how does this relate to somebody who's maybe much older and is hunched over and really their head is protruded? They have the really exaggerated kyphotic curve in
Yeah.
the thoracic spine. Is there something more going on there than just posture then? I mean, it almost seems like, I don't know, it almost seems like the actual vertebrae are the bony structure. There's something going on there, but
Yeah. And so, if this is a 50, 60, 70, 80-year old, then we're definitely possibly getting some bone changes that are kind of exacerbating this problem. In general, so long as it's not, something super specific and abnormal that you were born with or something like that, it
yeah,
is just kind of the weight of life
right.
starts bringing us down and forward. But then with that, again, it does exacerbate the lordotic curve, because even as I see some very bent over old people on their walkers at the skilled nursing
Yeah,
facility.
yeah, I'm
And
sure.
that lordotic curve, while it is now, it's almost like they're horizontal with the body, but to see or to with the ground, but to see in front of them causes this extreme extension and exacerbation of the lordotic curvature of the neck.
Right, right. And there's probably other systemic things going on, like osteoporosis or like you said, bone changes.
Sure, sure. But then with all those things, you'd be really want to careful to come back to these natural curvatures, because with
Yeah. Okay.
osteoporosis, you're weakening the bones. And I'll talk about it a little bit later. But as you're putting more pressure, the body's adept, and I've said this before on the podcast, the body's adept at dealing with stress. It's just a matter of putting that stress where it's supposed to go. And as we get these more unnatural spinal postures, we're putting stress in areas that it may not be designed to go. Whereas an example of like osteoporosis, the person may end up with a wedge compression fracture in the front of their
Right.
spine because now all that pressure shifted to the front. But then on
Yeah.
the flip side, if they over exaggerate it and we have this over extension type posture, we may set ourselves up for like a pars intercalaris, which is a little fracture of a portion of the vertebrae from bending back.
Yeah.
So it is, again, no fine or no one size fits all, but really assessing what you need and addressing it as a whole. Because that you bring up a great example just of if that kyphotic posture is increased, generally what I see is an increased lordotic posture. And that's generally what I see along the chain. So if one curve is increased more than it should be, the next curve has to compensate in some way. So you almost get, this kind of zigzag like increase of each curve as you
Right.
work your way up the chain. because the
Right.
curves are natural and they have a purpose. And in that cervical spine, allowing for a lot of motion as part of the orientation of the vertebrae, but also it supports the crown of the head and it supports the weight of the head. And there can be a variety of causes to that cervical lordosis, like we just talked about. One of the big things, just as a whole, again, everyone needs to be evaluated for specifics, but just in general, one of the biggest common things I see that leads to this increased cervical lordosis, especially with the guys I was talking about, where we're kind of, proud chest looking up, and then we end up just kind of super relaxed on our neck, and we're just kind of like letting our head hang back.
Right.
It's due to these deep neck flexors. So you have muscles along the cervical spine that control the lordotic curvature, but they flatten the lordotic curvature so they don't let it get too C curved or too out of control here. And those deep neck flexors are often very weak on people. If you are looking to look those up, they're called the longus colli and the longus capitis. Those are some really important muscles to begin to address to help control that lordotic curvature. And again, not that we want to reverse it or that we want a perfectly straight neck. We just don't want it too far any one way.
Okay.
And another reason why a cervical lordosis can kind of increase our pain is it pinches down on nerve roots, right? Which can cause a variety of discomfort. It can radiate all the way down through the arm or just affect wherever the nerve distribution is. And this is what we typically see, like a cervical fusion or patient, discectomy or a laminectomy or things like that, where they go and they try and clean up some of this compression to allow the nerve to kind of exit through these areas. If you have an increased lordotic posture, you're likely going to be compounding and compressing down on those nerves. So again, those deep neck flexors can help open up the back of the neck, which is what most of us need. One more thing here, just kind of about a specific segment of the spine. This is where people have a lot of discomfort, that cervicothoracic junction. So this is where the thoracic spine and the cervical spine meet. Why this ends up being such an area of challenge or discomfort for people is because, like we just talked about, cervical spine, very mobile. If I had to, if I had to make one segment say it was the most mobile, that'd be the cervical spine. It can rotate, it can side bend, it can flex and extend at pretty high ranges of motion. Then we get to the next segment of the spine, the thoracic spine, and it is the stiffest, most rigid portion of our spine. And again, we're going to start to get an appreciation for, we're going to have a really stiff, rigid portion in the middle, and the other two, the lumbar and the cervical portions, are going to be really mobile. And so that tells us just kind of about how we use the spine and how we need to keep these areas healthy and safe. So with that cervicothoracic junction, we know we're essentially coming to a point where this segment moves a ton and we have a lot of mobility and we're getting to a really stiff area. And that's why people tend to have a lot of discomfort around that cervicothoracic junction, which again, if you're feeling along with the episode, if you find that C7 vertebrae or just the biggest, boniest prominence kind of on the base of your neck on the very bottom, that's pretty much the cervicothoracic junction. So it's C7 vertebrae meeting up with the T1 vertebrae. And there is where a lot of people around that spot have a lot of discomfort, just because you get this area of high mobility meeting an area of very, very rigid. So with that, this is where people often feel like, oh man, I need to have my upper back popped. And like, I just really need this pop so I can just feel better and move. And I just feel like there's some sort of limitation there. Another reason why that area is kind of at risk or is going to have more stiffness than other areas of the spine is if we think about the shoulder, there's a ton of muscles that attach to like that C7, T1, the cervicothoracic junction area that play a huge role in our arms and our neck and things like that. So I'm talking like traps, rhomboids, big muscles like this that play a big role. And as we get more forward and our arms get more forward, we're really stretching and pulling on those areas, which is even more so going to limit their mobility and can give us that big like achiness feeling. And so with that, we talked about kind of what some of those main causes of pain may be. And what we need to do to address them. So again, having increase of a curve or too less of a curve can increase our pain, and it can just depend on what tissues we're exacerbating there. And we want to kind of work on the ability to control that cervical lordosis. So we really want to develop some neck stability, and that starts with exercising those deep neck flexors. So I'm going to give people a few exercises that they can go look up on YouTube. If you're looking to find these on YouTube, you can literally type in Bryan Brozy, my name, and then the exercise I'm about to list. And that's just the quickest, easiest way to find it. It'll pull right up. So for controlling that lordotic curvature and working on the strength of those deep neck flexors, try the chin tuck exercise and the bedtime decompress exercise. And those are two exercises on my YouTube video. There, what you're really trying to do is just develop the strength of the longest coli and the longest capitis. With that bedtime decompress exercise, I've kind of added some work, some strength work to some degree of the muscles that we mentioned kind of around that cervical thoracic junction. So that should really help kind of control the cervical lordosis and create more stability within the neck. We also want to strengthen those muscles like I talked about around the cervico-thoracic junction. The bedtime decompress is a great one. I also have an exercise called flashers and the underhand band pull apart that I really like for this area. When people feel like, hey, I've been sitting for a while and I really need that relief or that pop to the cervico-thoracic junction, one of my favorite things to do is use a foam roller and kind of do a back bend. Yeah. I can also do that with cradling my head. So what I'm doing there is trying to like create a ligamentous lock. So if I flex my spine and my neck fully, I'm going to tighten all the tissues in the back, right? Like I've stretched them out.
You're stretching them out.
That's going to help me isolate whatever area I'm trying to roll and get to pop a little bit more, because I've taken the tension out of the areas above and below and try to address just that one area. I've done it in a video. It's called my upper body foam rolling routine. So again, Bryan Brozy, upper body foam rolling routine. We'll pull it right up. And I'm doing at the end there, I believe I'm doing the back of my neck and I kind of walk through that process.
Oh, that's good. That's kind of counterintuitive, right? Because you're kind of holding yourself in flexion and trying to.
Yes.
Instead of just relaxing on that foam roller.
Yes. Like which you can totally relax on that foam roller. And that's great. All I'm doing by holding yourself into flexion is trying to make it more specific to that area. Create that ligamentous lock. And this is something, a chiropractor or a physical therapist, you'll see if you just pull up a video of a manipulation or a mobilization, they do this. So like, for example, when you see people get their lower back popped, most often you will see the chiropractor kind of pull their knees as close to their chest as possible. Mm-hmm. And what they're trying to do is create that ligamentous lock. So they're pulling the spine into as much flexion as possible, so everything's nice and tight, and then they can just rotate around whatever segment they're trying to rotate. Right. So you're using the body's tissues, putting them on maximal tension, and then just not tensing the segment you're trying to move. And then you mobilize that area. And that's essentially what you're trying to do with cradling your head, letting the portion that you're actually trying to address go into extension, but don't let the rest of the neck or the rest of the chain fall with it. So you can actually cause the extension at that moment or at that area. And then the last thing I wanted to mention is just give you guys an idea of what you can do to support these natural curvatures in like a resting state. So sitting on the couch, sitting in a chair, reading a book. So there, of course, we have this reverse C curve, this lordotic curvature, and we just want to support that. So lying down, putting a pillow in the nape of the neck, that also supports the head as well. I know we've probably all seen like those pillows where they kind of have the natural curves etched out.
Yeah.
There's good and bad in regards to those pillows, but that gives you an idea, at least at like, you're trying to support the middle of the neck that does kind of reach its highest peak in that lordotic curvature. And then you also want to support the weight of the head and just give it some support in the natural resting position. So again, not, too far retcheting into flexion, or also not just hanging back in extension the whole night either.
Right.
And then sitting, anything you can do to support the head and the posterior neck to just kind of allow relaxation around the neck, but not overly exaggerate the lordotic curvature is what we're going for.
Okay.
So that's the cervical spine. Now we're going to move to the thoracic spine. This is a kyphosis. This is the opposite. This is where we actually have a C curve. Like if we're looking at a capital C, that, you know, we're looking at the side of our body, we would see more of like a C curvature versus the reverse C that we see with the lordotic curvature. So kyphosis, more of a natural C-like curvature. Big thing about the thoracic spine, as far as structure goes, like I mentioned, very, very rigid, right? And a part of that is we've got the ribs, those ribs attached to the sternum, and those ribs create a lot more stability and stiffness within the thoracic spine than any of our other two areas of the back. Obviously, they're protecting a lot of vital organs, so it's pretty important for that to be, you know, you don't want your heart moving around as much. You don't want your heart twisting
right.
and turning.
Yeah.
And then here, as far as the facets go, and again, the facet just being where the joints move on each other. I mentioned in the cervical spine, they're like 45-degree angles. So as you move, they just kind of glide upwards and down based off what movement you're doing. With the thoracic spine, they start at about 45 degrees and everyone's different. This is where there is no perfect posture, but they start at about 45 degrees. And as you work your way towards the middle spine and down, they get 90 degrees, basically perpendicular with the ground. And what that tells us, the rotation component is now not as much, and we're more so just talking about flexion and extension here.
Yeah.
So because of that orientation of the joint surfaces, it's no longer, you know, set up for rotation as much as the cervical spine, especially when you couple that with the ribs that are now there. So these, we obviously tend to get tightness. People are very commonly report feeling very tight in their upper back. Mobilizations or manipulations can really help with this. I'm going to give you a few ways to do that yourself. And part of why we feel this achiness and this pain is partially due to that forward head posture and that kind of rounded posture we were referencing in the beginning. And with that comes a variety of overstretching the muscles, getting really weak. You're even stretching and stressing the ligaments in the back there as they're just, you know, kind of holding on to, you know, they're just further going into a kyphotic curve that we really need to relieve. So with that, some main exercises, some main things that we can do to correct it are try and reverse that thoracic kyphosis. And again, we're not trying to reverse it permanently. We're just trying to really mobilize the spine. So anything that we can do to not let our thoracic kyphosis increase, but stay at its natural degree, and then really kind of mobilize ourselves into flexion and extension to help create a more lubricated joint is helpful. So some exercises specifically are those band pull aparts, book openers, flashers, rows, a prone press up, kind of like an upward dog in yoga.
Yeah, like Cobra or something, right?
Yes.
Yeah.
Any extension of the spine. And again, the exercises, I'm listing exactly how they are titled on my YouTube page. So if you just say, you know, what is a band pull apart, and you just type my name, the band pull apart.
I'm not quite sure what a book opener is.
It'll pull
just
right
type
up.
your name and it'll pull up. Okay.
Yep. And then the book opener is a great one for rotation. So just check out that exercise, and it's really helpful for relieving that tightness. And we know that the thoracic spine really isn't great with rotation, and it's a rotational drill of thoracic spine that I really love. So definitely give it a try. But as far as static sitting with the thoracic spine, we want to support this curve, but we don't want to allow it to further exacerbate, right? So we're not pushing ourselves forward, but we're giving ourselves some support along the curve and able to rest backwards. Like if we're sitting in our chair at our desk, there's support along the curve, but we're just able to rest in a way that doesn't feel like we're falling forward, if that makes sense. So if I'm sitting in a chair and I'm able to kind of lean back, I've got my lumbar curve supported, and I still have that natural lordotic curve, I'm going to feel the mid back kind of touch the chair. And I just want to rest along the back of the chair. I don't want to start leaning forward. And that can really cause just kind of undue stress, and typically is what we see, right? We're often sitting at our desk, leaning forward, working on something. And we just want to support a more upright posture when we're sitting. And that's one of the best things we can do for the thoracic spine.
And you certainly don't want to go lean back into full, extension with,
Not in a,
puffing your
a typical
chest out
sitting.
or something. Yeah,
Yeah,
not in a
not in a
typical
typical
sitting.
sitting. What I'm talking about now is more so like if you're at your desk, how should you set yourself up? And yeah, you
Right.
definitely wouldn't want to be in full extension. But then that said, people get these achy backs and just feel like the middle back, the thoracic spine really needs to move. And that's where, based off what we do on a day-to-day basis, things like Cobra and extension-based exercises are really helpful for kind of lubricating the joints and reducing some of that
Right.
discomfort.
Yeah. Yeah, we do that. We try to do back extensions in our stretch class every Tuesday, where we focus a lot on doing a lot of those extension moves, since we don't really do it a whole lot in
Exactly.
ordinary life, right?
Right.
Extension.
Right. And then here it's just where we don't want to have that question mark posture because we know it's going to exacerbate the curves above and below. And what I mean by question mark posture is that kind of curled up, really increasing that kyphotic posture of the thoracic spine.
Yeah, and when we did that sitting podcast, I mean, you talked a lot about what it actually does to the internal organs too, right? I mean,
Yeah, we talked about that. We also, I don't want to misquote it, but I'm almost I quoted it correctly in the combating sitting episode, but there's a study done that's like with each inch of forward head posture, it's either the weight the weight of the head
oh right,
doubles or it's like
yeah,
8 pounds more, something like that. I think it doubles. So if you
yeah,
if you get 2 inches forward, which sounds like a lot, but then when you go to a skilled nursing facility, most of the people are 2 inches forward. You can
mm-hmm.
only imagine the amount of stress that's putting on someone's thoracic spine, and then thus subsequently increasing that lordotic curvature
Yeah,
so they can actually see where they're walking.
right, right,
That's why we're talking about it in segments so I can help. Essentially the impetus for me doing this podcast was I had one of my friends here who doesn't do anything for his health, doesn't work out, doesn't,
right,
just average guy, doesn't really, if it's working, it's working. If
right, right.
his body's working, he's good to go. And he started talking to me about his back pain, how he just has this really achy lower back. And it's just very generalized. He can't point to it and say, hey, the pain's here. It's just this achy lower back. And every time I'm looking at the guy, he's like, hands, elbows on knees, sitting forward type posture and this big old question mark. And that was like,
Yeah,
hey,
I've
man,
seen that so many times.
right. You got to
Yeah,
know a little bit about spinal alignment. Just so when you're sitting here on the couch and we're hanging out, just resting, and you're telling me your back hurts, all you have to do, and it's so funny, I just went over there and just placed like 3 or 4 pillows to support him a little bit more naturally, and everything was just fine. He probably could have laid there all day. But so
yeah,
it's about knowing where to provide this support, knowing that you have a lordotic curvature. So if you're laying on your back, you want to support these lordotic curvatures,
yeah,
especially in the lumbar spine and in the neck. So thoracic spine, that's an area where we typically just feel tight, stiff, and there's a variety of ways we can alleviate that. Part of it is working on the muscles that will help control the shoulder girdle and keep that from causing
yep,
increased stress on the thoracic spine. And another part is just being daily and habitual about doing some extension flexion, which I'll sort of talk about here at the end. And yeah, so like I said, just to wrap up thoracic spine, when sitting statically or just quiet sitting, just be sitting in a way that's not propelling you forward primarily. And like you said, Keoni, obviously no exacerbating of the extension component here if you're trying to rest or you're going to be in that position for a prolonged period of time. But what I see most commonly is we're at our desk and we're at our chair and we're leaned forward as
right,
opposed to, hey, let's sit back and use the beautiful ergonomics of the chair.
right, right.
And so for the lumbar spine, now we're moving to the very bottom, the lower back here. We are all pretty familiar with this one. This has a lordotic curve as well. Speaking on the lumbar spine, its spinal structure, this consists of 5 vertebrae. They generally get larger as a whole when you move down the spine because they're bearing more weight. And that sort of tells you possibly about the purpose of these curves, right? So again, we saw a lordotic curve at the neck because we know we have at the top, the head and the weight of the head kind of coming down on our spine. And then in the lumbar spine, we're dealing with a lot of body weight. And so we have also a lordotic curvature to kind of help with that curve, to help deal with the stress and the weight of the body through that lordotic curvature. Here, the joints are viewed, when they're viewed from the side, Keoni, these facets, they're at a 90-degree angle. So here we're talking flexion and extension is primarily what we're allowing, just like the thoracic portion of the spine, but here probably more so. Again, okay. Thoracic spine, the most rigid, least mobile. Interesting thing about the lordotic or the lumbar spine and their facet joints, again, where they articulate or just move on each other, is they actually have like a J-shaped curvature. So while they do go up and orientate at 90 degrees, they kind of have a lip to them that limits rotation and kind of limits extension. So the lumbar spine is really where you're going to have the most mobility in the lumbar spine, which we can all probably attest to this, is just forward bending. So bending over to tie your shoes.
Yeah.
You're going to be the least limited in kind of rotation, side bending, and extension. But with that said, the flexion is primarily where you're going to have the most problem, typically in general with our general population, not necessarily if there was a specific injury. But so in regards to that flexion, we know that this can kind of increase discogenic pain. So as we're bending forward a lot, we're getting kind of this posterior migration of the disc material that can cause like some disc bulging or some things like that can put pressure on tissues that make you achy, give you a sharp pain, or possibly give you some sort of nerve distribution of pain. So there, the flexion has kind of pushed, the middle part of this jelly donut more posteriorly. And if we continue to be very forward flexed through our lives and just be consistently reversing that lordotic curvature, we're just asking to bulge those, the nucleus pulpus, just bulge the center of that disc out and have pain.
Out, is it out and back? Is that what you're describing?
Yes.
Or just out in general? It's generally out and back.
It's generally posterior lateral. Okay. You can have a variety of different types of bulges or areas, but it is generally posterior lateral. And that's generally why people have like sciatica or a radiculopathy of L5, S1, those sort of things, where it's just
doctors just
pushing on the nerve.
Right. And the PT or a doc is saying you have a, bulging disc issue that most of the time, I think you said this in a couple podcasts, most of the time that does not require surgery or more invasive type stuff, right?
Absolutely not. Again, I don't want to misquote a study here, but I can say with 100% confidence, there are a variety of studies that look at MRIs and different imaging and saying, hey, we took a group of 80 asymptomatic, meaning no pain, no problem. We just x-rayed their back or we just MRI'd their back. And it's a ridiculous amount. It's like, because I don't have the number, I'll lean low, but it's like 50 to 80% have some sort of disc bulge, have what would be classified as degenerative disc disease, or have some sort of disc narrowing or narrowing of the lateral foraminal stenosis.
Yeah,
and
it's not causing it's not causing a problem for them, right?
Right.
Yeah. And even if it was, I'd imagine some of these exercises you're talking about, if you do them in not in an exaggerated way, but do them, can you, in a sense, massage that disc back in?
You can certainly help migrate that disc a little bit more anteriorly. And it all depends on to what degree did you have a disc herniation. Maybe we can do a whole episode on disc herniations, but you certainly can impact, just because, and we'll go back to how we were breaking it apart, right? If you are bending forward, and people hate this and people love this, but the disc inside the vertebrae or in between two vertebrae is kind of like a jelly donut in the sense that there's an outer layer and then there's an inner layer that's very gelatinous.
Yeah.
Now it's not as flimsy as a jelly donut, and some people hate this analogy. Some people love it. But the point is, as you bend forward, you're putting more pressure on that forward portion of the donut. Thus, the jelly is kind of migrating posteriorly.
Backward, yeah.
So if you bend backwards, it's possible to flip that thought and think you would be sending some of that jelly more anteriorly just through pressure.
Right.
Another great way to help reset kind of where that nucleus pulpus sits in the intervertebral disc is by hanging. I love dead hanging.
Yeah, I was definitely gonna bring that up. About, I'm glad you brought that up because I actually recommend that quite a bit to do types of inversions. Right? Is that what you're talking about?
Pretty
With
much. Yeah.
yeah,
Yeah. And what that allows is, again, all these, an intervertebral disc is enclosed within itself, unless you had a disc herniation. Some of that may be leaking out, but it has pressure to it. Within this jelly donut, there's pressure, and as you pull those two joints apart, like you would be doing if you were dead hanging from a bar, that helps change the dynamics of the pressure and help realign that nucleus propulsus more towards the center of the
yeah,
disc where you would want it.
yeah.
And again, this is why it's so important for, I feel like, to do topics like this, because this is not something you need to do if you're in pain. This is something, hey, if you hang 3 to 5 times a week, you can help stave off back pain for a lifetime.
Yeah, and in theory, you may even be able to stave off
Mm-hmm.
osteoarthritis. I mean,
Mm-hmm.
I think I talked about this, or maybe I asked you, or maybe you told me about this, but it's like it's in the medical text that animals that hang upside down, right? Didn't we
Yeah, you
talk about
talked
the
about that.
animals?
Yeah, we have
Okay, yeah,
talked about
animals
that.
that hang upside down, there's been no, or most of their lives, there's no evidence of osteoarthritis
Mm-hmm.
in them.
Yeah, that
Whereas
makes sense.
everybody else, the gravity, just living on this planet, and gravity causes that to happen over time, except for animals that hang upside down. I find that fascinating. This even happens in like aquatic animals. They still get osteoarthritis.
Yeah.
So sloths and bats. Anyway, that does it for me as far as, yeah, if you can get an inversion table or whatever, or do some sort of inversion, whether it's yoga inversions.
Even just
Yeah.
hanging and letting your hips be really heavy and just cause
Yeah,
that
I mean,
pressure
you
that way.
could do this on like
Chin up bar.
incline bench, right? Also, right? Just hanging down a slope. Would that do
Yeah.
it?
Yeah. You certainly
Yeah.
could do that. You certainly could do that. You can do it on a chin up bar just hanging, because the
Yeah.
gravity is going to assist you there as opposed to hurt you. And again, you just bring up a great point about why the alignment is so important. Because if we go, like I said at the beginning, if we have, the body is really adept at dealing with stress. It's just a matter of putting the stress where it's supposed to go.
Okay.
When the weight and the stress is through the vertebral bodies like it's supposed to be, we have a
Yeah.
very healthy spine. When we
Yeah.
start getting this forward head posture, or we start getting really exacerbated in our lordotic curvature, we're compressing those facet joints.
Right.
We're compressing them. That leads to things like osteoarthritis,
Right.
and further problems down the road.
So even just grabbing onto a chin up bar and just letting hanging onto it, not necessarily an inversion where your head is below your hips.
Yeah,
Yeah, that
correct.
will do it too.
Yeah.
Yeah.
And then cool. So that kind of wraps up as far as like this. The lumbar spine is more meant for flexion, and thus we need to be careful with our flexion. That is where primarily people hurt their lower back, because if we think of it, as we're trying to think of it in this episode, as a huge kinetic chain, let's say your hips are really tight and your thoracic spine, which is very rigid. And then you go to bend over and tie your shoe and you just get this really reversed lordotic curvature. You're putting a lot of stress on the posterior portion of your back. And
Yeah.
this is how, possible disc herniations happen and things like that. So we want to work on above and below to make sure segments move appropriately.
Right.
Um, so some general, so we've kind of brushed over it. Main causes of pain: discogenic pain, nerve compression, general compression of the spine. Just to give people some ideas of things they can go listen to if they're looking for more, kind of like that topic or the conversation you and I just had about the different animals and inversion and things like that. Episodes 44, 112, 140, and 148. We have all covered lower back pain and different aspects of it. So if you're looking for more, in regards to your lumbar spine, your lumbar health, lumbar pain, those are great places to go to after this. So general lumbar spine hygiene tips, exercises. This goes back to what I was talking about, bending forward. We really need to develop a healthy hip hinge pattern. And a hip hinge means the movement is coming from the hips. We're increasing hip flexion while maintaining a nice neutral spine. And again, neutral means continuing to maintain those natural curves. So there is a little back bend of a curve as I want you to try and reach down and tie your shoes or lift the Amazon box, off the ground to bring it into your house. That's going to help you support this natural curve without putting too much stress on your back through flexion.
Right.
Now, with that, I just want to throw in the caveat. You should be flexing your spine. It's just a matter of how much load goes with that flexion, and doing it in a safe and proper way. But in all of these motions, motion is lotion. So when we talked about the ribs, we talked about them not, or the ribs, the thoracic spine, we talked about them not rotating much. But then one of my favorite exercises is this book opener exercise, which is all about thoracic rotation. So it doesn't mean we can't work on these things or that we don't want these things to occur. We just want them to occur in appropriate levels and in a safe manner.
Yeah.
So hip hinge practice. I love what I have people do when I taught kettlebell classes, and I was trying to express the hip hinge real quickly, is we would take a broomstick and you would have that basically be in contact with your sacrum and your head and try and maintain as many points of contact with the broomstick. And you're just going to send your butt back until you hit the broomstick with the wall. The only thing that should be moving in that instance is just your hips. It should be like you are reaching back for a chair. And eventually, if there was no chair there, or you could just reach endlessly, you would just fall down into a seated posture.
Yeah.
And that's one of the ways I really love to rehearse it. And that helps really kind of demonstrate and begin to carry over with these functional movements, like as you bend over to grab the Amazon box, with maintaining this natural lordotic curvature. Some of the muscles that are involved there are the transverse abdominis. Thus, a transverse abdominis contraction exercise is very helpful. I have like the McGill sit-up or TA contraction, which is on my YouTube, so you can look those up. And then a Palloff press, which is just a way to really work the core and minimize any movement of the lumbar spine, but really challenge the muscles of the core to maintain that nice integrity of our natural curvature. When you're static sitting or driving, as an example, you want your lumbar spine supported with a pillow. So even as I'm doing this podcast, I literally have a pillow behind my lower back that is supporting the natural lordotic curvature of my spine. And then that helps even support my nice upright posture of my kyphotic thoracic spine. And then make sure I'm not leaning too far forward and then looking up to talk to you, Keoni, and exacerbating my lordotic curvature. So the biggest thing here is get some lumbar support. 85% of the time, that lumbar support button on your car is not enough. It helps kind of fill in the gaps, but if you can add a little pillow or an extra barrier of support there, it'll make a big difference. The big caveat I would add with that is, again, just like all these other things, you don't want to be pushing too far into the posture. It should just be a comfortable, nice, natural position and feeling. When laying down, a pillow under the knees or having the knees bent can allow some relaxation of that lumbar lordotic curvature. And that can feel really nice for people, especially if they're overly lordotic in their lumbar spine. We see with the lumbar spine, I would say I see equal, reversed and really flat or C curved type lumbar spines, or I also see a lot of exacerbated lordotic curvatures where we're really bent back. And that can be for a variety of reasons. But instead of leaning forward in the chair, think about sitting back and being supported in all aspects, up, down, through the neck, through the lower back. Just be supported and support those natural curvatures. It's important that the whole chain be properly aligned. A change in curvature at any location can impact movement along the chain. So like I've been saying, body's adept at dealing with stress as long as it's put in a proper order or put where it's supposed to be. If we change or we have too much, like my friend, for example, who has this really reversed lordotic curvature, reversed lordotic curvature where it's really flat or it's really rounded, not how it should be. He's getting a lot of stress and tension to his lower back. He's really stretching out a lot of these tissues. Thus, you get that general achiness. And some of that may be discogenic, and some of it may just be some of the ligaments and tissues being like, man, I have been so stretched out. Can you give me a breather? And you can give them a breather by putting a pillow in the small of the back and kind of help supporting that natural lordotic curvature. So last but not least, Keoni, I have some top 5 exercises for a fully healthy spine that I think you could do every day, and it would really help people in the long run maintain a nice healthy spine. With all of these, again, Just type in my name, Bryan Brozy, into YouTube, Bryan Brozy, followed by whatever the exercise is you're looking for, and it should be the first thing pulled up.
Okay.
So number one, cat cow. Again, this is just movement and lubricating all these joints. So cat cow is just going into extension and flexion and extension and flexion of the spine. And this is just going to help lubricate your joints, keep them healthy, stave off that osteoarthritis, and hopefully get you just feeling more mobile as a whole. Just a
Yeah, I know
little.
what that one is. It's basically you're on your knees and hands and knees and just flexing and extending your spine.
Yes, and you can even do it seated, just pulling your chest
Yeah,
forward and
sure,
rounding
sure.
back. So yeah, there's a
Right.
lot
Yeah,
of
that's a good
ways to
point.
do it. And with that, I know Dr. Stuart McGill, who we've talked about on here, he's like one of the foremost back experts in the world. He specifically talks about and did a study where they found out what was the specific number of reps that would decrease the coefficient of friction the most within a joint, thus decreasing how much friction you feel, how much restriction you feel as you move. When you wake up, you feel super stiff and then you kind of loosen up. So how many reps does it take to loosen up? 7. At 7 reps, the coefficient of friction was decreased the most it was ever decreased. They did 100, it wasn't decreased anymore. They did 6, and it did not reach the level of 7. So
Lucky
7 reps
okay.
of all of these things and how quick is that in the morning? Roll out of bed,
yeah, it
hit
takes
the floor,
no time.
do 7 cat cows, and just lubricate your spine for the rest of the day and feel great.
Yeah, that's great. That's really good to know. 7. That's fascinating.
So bedtime decompress. This is an exercise I also have on YouTube. Here we're really working on controlling the cervical lordosis with those deep neck flexors, really strengthening the ability to control the neck and limit how much lordotic curvature we're going into. And we're also, with this exercise, I really like it because it's addressing some of those muscles that kind of make that cervicothoracic junction pretty achy.
Is this just pressing your head into the pillow?
Pressing your head into the pillow. You're also doing a little bit of a scapular retraction.
Okay.
In the video, I describe exactly how I want you to do it, but it's using those deep neck flexors and then using the scapular retractors to really try and create a nice, beautiful alignment and support the muscles that generally get weak from our sitting and forward reaching posture, and really supporting our natural curves as well as strengthening the support that those natural curves get. I love it. That's one of the ones I count sheep to. So like if I can't sleep, I'll do that exercise until cows come home. And I'm often getting like pops to my mid thoracic spine, my cervicothoracic junction. And I find it feels really relieving. With it, you should feel, just a little aside, when you're doing the chin tuck or this bedtime decompress, it's not just this overpowering tucking of the chin. What I want people to think about is I want you to think about lightly pushing back into whatever surface. So if you're laying on a pillow, you're lightly pushing back, or if you're driving in your car, lightly pushing back into the headrest, keeping that light push back into extension, and also lightly tucking the chin. And so what you should feel here is like you are gaining length through the crown of the head while retracting the chin down and back. And you'll feel that stretch through the back of your neck, and you'll feel the activation deep in the front of your neck of those deep neck flexor muscles. It's called the bedtime decompress. Look it up on YouTube.
But you can do it while you're sitting in a car or whatever. Yeah.
These are some of the exercises I give to patients like on their first visit. And it's like, hey man, I just need you to do 2 rounds of 30 every day, however you can do them. Like if you can do them in the car, that's great. So all these things, like we even said about the cat cow, if you're sitting in traffic, you can do it in a seated posture. So you can find ways to do these things.
Yeah, instead of stressing about while you're waiting on something or doing, how long you can do stuff like this, right?
Indeed. So the last 3 here, the book openers, that's an exercise I really love for rotation of the cervical and thoracic joints. Again, it's on YouTube. You are just it's like you're a book laying on your side and you are opening the book. You're the book and you are opening, causing this rotation of your spine. If you check it out on YouTube, it'll definitely make sense.
Yeah.
Another exercise I love is the flashers, really working on some of those muscles and the strength of the cervico-thoracic junction muscles, and also helping decrease, because what we see most often is an increase in kyphotic posture of the thoracic
Mm-hmm.
spine. This will help decrease that kyphotic posture of the thoracic spine. And then number 5, hip hinge practice. So again, that's that broomstick drill I kind of talked about.
Yeah.
Doing a TA contraction and then progressing it, doing a Pallof press, bird dog, side plank, basically working on lumbar stabilization to support the lordotic curvature through functional movements. Functional movements, again, being bending over to pick up the Amazon box, things like that.
Yeah,
So those are,
I'd
yeah.
imagine doing these exercises wouldn't take really, I mean, if you did all of them, right? How much time are we talking about? Probably not a whole lot.
So you do 7 cat cows. Let's say you do 15 bedtime decompresses with a 3-second hold. We could just do 7 book openers based off that
Yeah.
law of coefficient if we're really short
Yeah.
on time. We do 12 flashers, 15 flashers or so. And yeah, do a TA contraction, which you could do seated in the car. You are talking about 7 to 10 minutes max to
Yeah.
kind of have a healthier back for life. And
Right.
that's why I think it's so important to get this information out there, because unfortunately people just, they know, but they don't know necessarily what to do or how to do it or where things go
Yeah.
wrong. And then also how easy, people, we know this as being practitioners. When we prescribe a thing to someone, it's like, oh man, how am I going to fit this into my daily routine? Now I got an extra thing to do.
Right. It's just one more thing I have to do. And I'm so aware of that when I recommend, medicines or anything. It's like it's just another thing you have to do. But it is interesting. Like a lot of our aches and pains are can kind of emanate from our spine, right? Like, outward into our body,
Yeah, they
shoulders and
certainly
everything.
can.
Like you can get rid of a whole lot of suffering doing simple things like this. So
Consistently too. Yeah. And
yeah,
just,
and then you keep a healthy spine.
right. And
That's
I think
supple
about
and
my
limber.
friend, my friend's 28, 27. He has, just this low level back discomfort now. Not a problem now, really. But if he got on to doing these things, he could completely get rid of it. But then also, if he just did nothing, yeah, by 35, he's going to be the
Mhm.
kind of guy that's going to go fishing one day and he bends over to pull, net the fish, and his back's going to quote unquote give out.
Right, right.
But if you
Yeah,
maintain, a healthy awareness throughout your life, you're in a much better position to kind of stave some of these situations off.
great. Yeah, I mean, it's great that, for my patients, putting this on there, just your name, cat, cow, they can go right to the video, right? Or
Yeah.
whatever the exercise is.
Yes. Yes. Yes.
Yeah, that's very cool.
Anything
All
else,
right.
Keoni?
No, I think this is so important. I'm glad you went over it. I mean, I think taking care of your spine it affects everything, right? It affects your internal organs. It affects everything. It affects how lymph flows. It affects your blood flow. It affects how well you sleep. And it's just a simple thing that you can do on a daily basis that will, again, mitigate a whole lot of suffering
Yeah,
that a
and
lot
don't
of us
become
deal with.
stagnant, right? Like, in Chinese medicine, we have the qi to kind of
Right,
reference this, but people do not move their spines. I mean, they
right.
don't wake up and do a cat cow and go through full flexion and extension. And you're getting really stagnant in these areas, for lack of a better word. It's little movement, little change in, the cellular situation down there
Hmm.
because you're not moving.
Yeah,
And motion is lotion. Motion will
right,
help bring blood flow, which brings food to your body.
right. Very cool. Thanks for giving us the list. The list. This is going to really help my patients.
Yeah, hope it helps. If you have any specific questions, feel free to reach out to me. And like Keoni mentioned, all these videos are online. Type in my name and type in the exercise, and it should pull right up. Happy to answer any questions anyone has. And until next week, be well.
Take care, everybody. Bye.